You are not only building digital products, but you're also building systems of care in one of the most politicized, emotionally charged, and urgent arenas we've ever got. And it's reproductive health, right?
What we have to do as a nonprofit when you build product is you truly have to think of users first. And that forces you to build fantastic product and fantastic purpose. So what we do is we look at the largest sexual and reproductive healthcare disparities that are happening in the US. And those happen to be in the buckets of unintended pregnancies, such as abortion, maternal health and maternal mortality rates, as well as sexual wellness. Like for us, humor is really important and just breaking down that anxiety or stigma that you have attached to even thinking or saying or writing down that question, right? I think the other thing that's really important to us that we found in the research that we do is if you answer a question, not something like, can lemon juice kill sperm? If you respond to it and if the response is like the size of a tweet, something about it feels very straightforward and people are like, okay, I can digest this. It doesn't feel like someone is talking at me.
Welcome to Unmissables, a podcast about how leaders in product, design, and technology are building what's next, while navigating complexity, their creative ambitions, and the kinds of questions that rarely have easy answers, but always deserve better ones. I'm your host, Ariba Jahan, and on this show, we explore how we can build smarter and more intentional products, systems, and features. So let's get into it. What does it take to build digital health products that center care, clarity, and trust? In this episode, I talk with Ambreen Molitor, a product leader working at the intersection of reproductive health, equity, and digital access. At Planned Parenthood, where she served as the National Director of Product Innovation, Ambreen helped launch and redesign tools like the Roo chatbot and Spot On, the period tracking app. Products that are designed not just to inform, but to really meet users who are navigating trauma, surveillance, and stigma with empathy and precision. Now, as the principal product manager at ZocDoc, she continues to build with a sharp eye on who health tech serves and how. So in this conversation, Ambreen and I unpack how her team at Planned Parenthood shifted from building in-house products to partnering with pre-seed startups and what that evolution revealed about urgency and alignment and power. Ambreen also walks us through a revealing experiment where they tested many different LLMs against their own content to evaluate not just for information accuracy, but tone and trust. And the results really opened up a deeper question about emotional safety, care at scale, and what readiness actually looks like when AI enters the chat. This one is for anyone who is interested or building in health tech, public interest tech, or just working in a space where trust isn't just a brand value, it's the product. Hi, Ambreen.
Hello.
Welcome to the Unmissables with Ariba Jahan podcast.
Thank you so much, Ariba. I love you as a friend. I love you as a podcaster too. So I'm very excited.
I'm so excited. I feel like the very first time I met you, I was like, oh, I can't wait to have her on the podcast. And we were both like, you were peak pregnancy. I was peak postpartum. And I was like, eventually we'll both be ready.
Now is the time. Now is a good time.
Now is the time. Now is the time. Ambreen, I've been so excited for this conversation because you sit at such a rare space. You are not only building digital products, but you're also building systems of care in one of the most politicized, emotionally charged, and urgent arenas we've ever got. And it's reproductive health, right? And you're doing it through a lens of equity and ethics and innovation all at once as the current National Director of Product Innovation at Planned Parenthood. And that's just so inspiring on so many levels. I would love to start with like your why, like your work sits at this intersection and what pulled you towards solving these kinds of problems.
Yeah, I mean, 18 years into my career, I feel like I now have a fully formed thesis and much like everyone else, my career is a little zigzag, but one thing I know for sure is I'm a die-hard tech nerd. That's just not going to change about me. And I feel fulfilled with purpose-driven work. So I found Planned Parenthood at such an opportune time. I mean, I found it through my network, but I stayed for the mission. And the mission to me is deeply personal. Everything we've worked hard to provide, whether that be abortions or STI care, or just general sexual and reproductive health care, I just needed all of that in my 20s and 30s. And quite frankly, right now, too, I won't really give away my age, but even now, I just so needed it for the person I am today. And I truly believe I would be hollow without these services, and my growing family would not be, without some of the things that we provided. So it's so important to me to have, and I'm so proud and so grateful that I've had all of those rights and services, and that I just really want everyone to be able to have, that sort of formulation of whatever they want their growing family to be. The other thing, and I'm going to bring back a little bit of my roots to this too, health tech is very interesting right now. It's incredibly innovative. Like the 2020s is like the narrative for when health tech went from being such a dry thing to the most happening thing with like such great innovators in the space. And I'm very, as I mentioned, the die-high tech nerd in me is very excited to be in this space and would love to, continue to build more and more chapters within it. But I also think about grief and fear that I've had for my immigrant family. It all goes back to the lack of affordable and accessible healthcare. And I feel like if we had that as a family, I don't think I would be grieving, and I don't think I would be so fearful for my family. And so I don't want to give that to the future generation, to my children. And I want to find and build solutions for that. So it's kind of sitting in both of those spaces there that I've found myself in this organization, and why I've stayed for, so long as well, too.
I mean, it's just that hybrid of personal mission and connecting with an organization that has a mission that you closely align with, and being able to actually explore technology in creating utility that serves the community, women and individuals with uteruses. So a quick primer for our listener, the terminology, even though we haven't really said it yet, I feel like some of the work that you do exists in the category of femtech. And femtech is a term used to categorize technology that supports women's health. It was a term that was coined back in 2016 by Ida Tin, who's the co-founder of the period tracking app Clue. But the term itself actually includes a lot more than cycle tracking. It's everything from fertility, menopause, pregnancy, maternal care, and more. It's a rapidly growing category. It's projected to grow at least to 100 billion by 2030. And yet it receives just a fraction of overall health tech funding. So like we're talking about health tech, but also when we're talking in this conversation, it's also that categorization of femtech. But your work at Planned Parenthood sits in this completely different space where the stakes are higher, access is fragile, and trust is everything. And I feel like Planned Parenthood has been a digital innovator way longer than most people realize, especially when it comes to user-first design. You guys launched the AI-powered chatbot back in 2019, Roo, before most health organizations even explored anything with AI. Your digital products have won Webbys, Effies, and even the VIVE Techquity for Health Champions Award, really recognizing that equity-first innovation in healthcare. And so I say all that to contextualize our audience on the category, but also the work Planned Parenthood has been doing. What do people still misunderstand or get wrong as it relates to innovation in a nonprofit?
So Planned Parenthood, for folks that are not familiar with this amazing organization, is a 100-plus-year-old nonprofit. And we actually provide services in 3 categories. The first one is care. And so that comes from the over 600 clinics that we have in the US and about the 2 million patients that we see annually. There's also a sex education side, and that's where we see up to anywhere from 500,000 to 1 million people in person providing sex education of different flavors. And then we have this pillar that's like more around the information of education. And that's the heart of what a lot of what we do in product and innovation is, really bringing both care and education forward. But the education and information space in particular is remarkable at Planned Parenthood. So we have close to 200 million people visiting our website, our chatbot, are, engaging with our apps and engaging with trained sex educators via text. That sort of context, 200 million is, if I'm not mistaken, roughly 2/3 of the US population. Like that's a lot of people. of people coming into that. So what I think is really interesting about Planned Parenthood as a nonprofit is whenever you think nonprofit, you think small. This is
Mhm.
not the case at all. We like the numbers we tackle are huge. It's what you see giant corporations, working with, the audience size, the sort of patient size that you see really connected, large hospitals and research centers doing. We're doing it as a nonprofit. And I think that's really important to bring forward about Planned Parenthood. And I think that also debunks this myth of that we are, we're an outdated, very small 15-person led team. We are very robust. There's about 700 of us, just in the national office, and like 600 clinics that are also employing many, many hundreds of people as well. So we are very large in size in comparison. So our impact is like incredibly large. And I think the other thing to bring forward to that is what's really awesome about building product in this in this space that has a large audience and has a large patient following is that what you have to do in a nonprofit. We still have we have the size of like a for-profit big corporation, but because our DNA is a nonprofit, what we have to do as a nonprofit when you build product is you truly have to think of users first. And that forces you to build fantastic product and fantastic purpose. There's a lot of great products that always say users first, and then you won't be surprised when you start seeing them make decisions based on what investors want or
Mhm.
anything driving the business. We literally legally can't do that. Like we cannot think like that, and that forces you to build just the most innovative and fantastic everlasting products too. And so I think that's one thing that's really important to know about Planned Parenthood is, when you think nonprofit, you think outdated, you think small. We are none of those things. And I think that is just the coolest part about this job that we have is that we get the best of both, right? We are faced in this like large landscape, but we get to really make good, meaningful decisions because of the DNA of our nonprofit side. That's really compelling to me.
Absolutely. I feel like there's going to be listeners who are going to tune in and be like, wait, Planned Parenthood has product innovation? I think depending on when someone was introduced to Planned Parenthood, right? Like whether it was their first place to get any care as it relates to their reproductive health, or it's been on the headlines, whatever it might be. I think this is going to be an eye opener for the level and the scale of impact, as well as the fact that you guys do product innovation. Now, what does innovation look like at Planned Parenthood today, and how has that evolved over time?
In terms of, how we define innovation, it's the same as it was 5 years ago, even a decade ago. It has to be the most resilient form of innovation. It's also the simplest form because we have restrained budget, because we have so much simplicity that we need to put in the design to get and make things more accessible. It's oftentimes constrained. I won't go into that as to why, but you can only imagine. And it's also the most necessary work needed in this particular moment in US history, specifically for SRH care, right? What that means is like that's the formula that made up our why. And in terms of what made up our how, that's certainly shifted. So traditionally, a few years ago, I would say before 2 years ago, everything we were doing was building product in-house. That's where you heard about the chatbot. We built the app. We built this fantastic website that gets a huge following. And then 2 years ago, we started thinking about what it would look like if we reversed that and we didn't build in-house product, but we thought about how compelling partnership could be. And that has been particularly fruitful in this moment because what we do now is we work with startups, and we specifically in the pre-seed era, and we work with them, co-develop, act as a client, and we customize solutions with them that support their vision and can easily integrate into our ecosystem. And what that has helped us do in these past few years is that it has helped us come to these solutions much faster than if we were to build it in-house because of so much of the policy, the red tape that we are now encountering that we didn't have in the past. And it's also a great way for us to step away from the stage and be competitors to these fantastic innovators that have great ideas, that really understand the community, that really understand the purpose a little bit more than we do. Not that we don't know what we're doing or we don't understand the purpose, but I think when you innovate in an organization that has so much policy, so much process, so much greater thinking, prevents you from being like that visionary that innovation really brings forward. And so that's been fantastic and such a humbling experience for us to bring these innovators that do not have the process or the red tape that we have to think through when we build things. And it's been like a very fantastic way of innovating. And in a meaningful way, it's very inclusive, and it really drives the sort of larger versus smaller kind of organizations to really build together and really be equals in solving the exact same problem we're all trying to solve together, and not butt heads and be one another's competition, essentially.
It feels like it allows for even a bigger multi-stakeholder approach because you are now able to partner with an organization that might have certain things figured out already, or they are a few steps ahead on the technology side or proof of concept side or market
Totally.
validation side. And then you're able to bring an idea with market validation to stakeholders within your organization. So you're kind of having a moment to skip certain internal steps, if you will, and then
Totally.
create a lot more buy-in. Yeah, I can see that. Before we go even deeper, I want to acknowledge the moment that we're in. I think since the overturning of Roe versus Wade, 21 states have already implemented either full abortion bans or severe restrictions. We know that access is changing practically week by week, and I'm sure you guys are having to track that. So it feels like when we're talking about innovation, we're not just talking about tech for the sake of tech, but we're really talking about tech in the case of education and access, and thinking about what has to be out there as people are navigating this crisis and responding to what is happening in real time, right? And I think you've said this earlier in a different conversation about the type of innovation you guys are doing, that it's simple, urgent, and resilient. And it feels like the most critical type of innovation that we need right now. So I think with those three descriptors, is there anything else you can share about the way that you are having to approach innovation, given that you are in the space that you're in versus being a for-profit driven organization that maybe has a different type of marching orders?
Yeah, I mean, so we're a nonprofit, and
Mhm.
what we're looking at in terms of our goals, they're not revenue goals, but they are impact goals. And so what we do is we look at the largest sexual and reproductive healthcare disparities that are happening in the US. And those happen to be in the buckets of unintended pregnancies, such as abortion, maternal health and maternal mortality rates, as well as sexual wellness. So that's in the STI space in particular, where STI rates are increasing. So for us, our goals mean we have to decrease like these despicable numbers that are increasing around SRH care. The number of unintended pregnancies are increasing. STI rates are increasing. Maternal health is obnoxiously high. And none of this should be happening. We're a first world country. So we look at ways that so in terms of those are our goals to increase, and the way that we could do this in a fast paced way that feels like a nonprofit, where we're looking at maybe annual goals, is we look at predicting indicators that can help us decipher that we are moving towards the high impact goals. And high impact goals for sexual and reproductive health, or just health disparities in general, take almost decades, to find that shift and to validate and say like that impact has changed in a meaningful way. What we're looking at it is we're breaking it down into sometimes even quarterly goals to see if there are any promising indicators that we've shifted that can sort of determine or deterministic of a more favorable outcome. So that's how we're thinking about
Impact and
impact goals. What is the
Mhm.
purpose of why we need to innovate, and why we're in this space in this particular moment too?
I'm sure that shows up in the way that you're even thinking about which startups to vet and how to partner with them. So I know you recently told me about a project you're working on where you're comparing different LLMs to Planned Parenthood's tone and accuracy standards, and you've been noticing that the differences are really wild. Could you share a little bit more about that project? Like what started it? How are you approaching it? And what have you learned so far?
So it started, um, it's such a funny project, by the way. For us, this project started, as you know, because we have a chatbot that we've launched in 2019, and there's just this huge assumption that this should be powered by an LLM, and I think that's very risky for us to assume, given who we are. And so, for the past year and a half, almost two, what I've also been, if you've noticed, lot happened in the past 2 years. We're pivoting in many ways. For the past 2 years, we've been looking at LLMs and measuring them against we have three evaluation guidelines or principles that we retain or look towards. And if someone passes it, then we say, okay, we're at feature parity in terms of the chatbot that we have right now. So the first one is accuracy. That's bar none. If you cannot simply just answer a question, and if you cannot reduce the number of hallucinations, that's just not it for you. The product is not it for you. LLMs are not ready for you or your industry. And so for a very long time openly, for the first year, so that was when GPT first became more public. That first year, it was just not getting it right. It was just not. It was like at the 40 to 50% accuracy rating. Now, if you fast forward to the end of last year, so like in November 2024, that's when you started seeing the LLMs improve significant, and everyone talks about it. That's when 4.0 came around, and it got really good. It got to a place where it was not only better in terms of answering accurately, but it was also so much more precise.
Yeah. And what types of questions were you asking to measure the accuracy?
Yeah, we were asking existing questions people asked us. So we have, not only do we have this chatbot that we've had since 2019, we're using historical data and comparing, but for over a decade, we've had a text platform that allows you to chat with a trained sex educator. So we're taking existing conversations, existing questions, and really asking these LLMs asking these prompts, right? Putting in these prompts and seeing what their response was. And we were comparing it to an existing prompt and response that we had already identified from our historical context that we know was accurate. It was very inclusive, and it struck the right tone for us. So those were the three factors we were looking at. So, accuracy is what we were starting to look at. We looked at bias, which, by the way, I think right now there's a lot of fantastic frameworks. Like StereoSet is something that's very popular. You see it in a lot of academic research, in industry as well. And it's fantastic, and I think it's something we would consider using, but it's always helpful for us to have like a diverse committee of humans just asking these, looking at the prompts, asking these questions and getting the responses and telling us if it feels applicable to their lived experience. I don't think any framework that we've seen quite yet has taken away the need for that. Yeah. It only enhances it. And then we have a lot of brand. The third one, as I mentioned, is tone. So for us, it's making someone feel not anxious or nervous or silly to ask the question is the simplest way of thinking about it. And in terms of, when we talk about tone, not just accuracy, there's a whole novel's worth I could talk about, but maybe my favorite example, if you don't mind, I would love to give you an example.
No, go for it. We have time. All
right. So one of the questions that we asked both Roo, a sex educator, and an LLM is, can lemon juice kill sperm? I just want you to know that's a very popular question, Ariba. So just so you know, top 100 questions. Here's what that LLM said. No, lemon juice cannot kill sperm. Using lemon juice or other substances as a form of birth control is not safe or effective. For reliable birth control options, consider methods like condoms, pills, IUDs. You can learn more about these on the Planned Parenthood website. Fantastic.
Wow, perfect.
But I'm just going to read Roo's response, and you tell me what you think is a better answer. So someone asks, hey, Roo, can lemon juice kill sperm? And Roo says, putting lemon juice on your genitals won't prevent pregnancy or STDs. But lemon juice can be used to make lemonade. When we're comparing these things, like what's really interesting is that the LLM is so serious. It's so right. It's too right. And I think when you're asking that question, a little bit of you wants to just be calm in asking the question and making, like, for us, humor is really important in sort of just breaking down that sort of anxiety or stigma that you have attached to even thinking or saying or writing down that question, right? I think the other thing that's really important to us that we found in the research that we do is, if you answer a question, not something like, can lemon juice kill sperm? If you respond to it, and if the response is like the size of a tweet, something about it feels very straightforward, and people are like, okay, I can digest this. It doesn't feel like someone is talking at me. It feels like we're cool buddies, Roo and I. Something about that over and over again, users prefer. for a user, it's just like, I don't even know if I need all that's a lot of information for just like this simple, silly question, right? And so those are the nuances that are really important for a user that, should I have looked at this, I'd be like, cool. They were like, we're a referral source. It's fantastic. But it really matters to listen to your users.
So interesting. I mean, as you read the two responses, the other thing that came that sparked for me was Roo was actually answering the question, the underlying question, the question behind the question.
Yeah.
So the LLM answered the question about lemon juice, but Roo was like, okay, you're probably asking this because you're trying to prevent pregnancy. So let me answer that part. So it was just interesting hearing Roo go for the question under the question. And I guess Roo's context is also you're coming to Roo,
Yeah,
known for sex
exactly.
education chatbot, right?
Yeah.
Yeah, that's interesting.
I think it's funny because humor definitely helps. It helps when like our users are looking at it. They just love that. They're like, this is great. I don't feel silly with, um, and this, I just go back to that Netflix show of sex education where it's just, people love that because it puts you in an environment that's very just playful, right? And like, that's what it should be. It shouldn't feel so sterile and like you're in a clinic and having someone with a lab coat talking to you about it. So anyway, that could be a whole podcast in itself, but just wanted to like lift up a very simple example.
No, I really like that because I think we in all these conversations around LLMs, I think we've been talking at the level of like either the LLM itself or the operator or like some sort of a wrapper. And I think we've been so wrapped up in the conversations around creative utility or productivity that I think the tone we've kind of forgotten, or maybe it's that conversation is happening in certain pockets that I'm not in. And I think that the only reference to tone I feel like I've seen recently is really how agreeable an LLM might be, where it's too agreeable and it's not challenging you or it's not having a dialogue with you. It's just agreeing with you. Versus I think what we're talking about is like that intentional tone based on the use case that we're putting it into, right? So interesting. Given where AI is, given where policies keep shifting, what signals or shifts are you paying attention to that could reshape a reproductive access?
Yeah, I mean, and this is not different than the conversation with Gen AI and Roo and all that. What we're thinking about, the way Planned Parenthood builds products is very similar to how we think about, advocacy too, right? We scenario plan both the best case and the worst case scenarios. So similar to our advocacy team, we also pay attention to policies, and that could be anywhere from like policies that change that would require us to retrain or respond totally differently to a particular question. And we also think about societal shifts. So like an example for us is, the rise of men being overlooked. And so we're paying particular attention to questions where someone that identifies as a male is coming to us and asking us a question. So that's how we scenario plan. It's oddly not very different than like a state legislature, and also oddly not different than an anthropologist. And that is how we, shape our product. It's so unique. Like in all of my other product roles, I don't think we look so closely at, how the House, Senate, or, the presidential administration is responding or performing. That's just not how we build product. Nor have I thought so succinctly about societal shifts or conversations or pivotal movements as I have for product and innovation in this particular role. So it's
Yeah,
very
I
fascinating.
imagine you have to be pretty closely tied to the theory of change that Planned Parenthood might have and how different pieces of that shifts year to year, or in this case, week to
Absolutely.
week.
Yeah.
And
Yeah.
and you have to kind of keep a close eye on that. What's a small but powerful shift you think could change the outcomes at scale based on what you've been working on?
Yeah. I mean, I think for us,
Yeah.
and it's interesting because I also just a few weeks ago went to a policy roundtable around just a tech in general
Yeah.
policy roundtable. So certainly applies to my response to, the shift that could help us scale, but also tech and health tech in general scale at large is that tech policy is starting to look a lot like the care policy where everything is, looking at access or rights at a state level. And this is so hard. It's hard because it stops and hinders innovation. And, I'll give you an example of something that really matters. So telehealth, for example, everyone has it. We all talk about, we've all used it. And I remember being in a strategic meeting in 2019 and we were like, okay, telehealth is available in 11 states. By 2030, we assume that, all 50 states will require all insurance companies to cover the care that someone gets from a telehealth appointment. At that time, 2019, 11 states. The pandemic hit. That was November 2019. The pandemic hit like months later. And
Yeah,
that's when the administration back then overnight was saying, okay, now every insurance company is
everyone.
required,
Yeah.
needs to do that. And you know what that did? That allowed everyone that was in the health tech space that was slowly progressing and innovating and thinking about 2030 to like innovate overnight. Something that we thought would take a decade to do, we could do in 3 weeks all of a sudden. And that's what we did. In 2020, in 3 weeks, we spun out our telehealth feature at Planned Parenthood. And that's not different than many other healthcare companies. But, it also gave us in 2020, because of that change, so many health tech startups spun up. You started seeing the competition explode at that time. And what that really does is that's just a small example, but that's how
But it's a
innovation can
big
happen.
one.
Yeah.
Like a huge behavior shift happened, right? Like we went from only being able to see our doctors IRL
Yeah.
for most things to suddenly it's fine over a Zoom. I remember hopping on through my phone, showing someone a rash I had on my eyelid, and
Yeah.
I would have never been able to do that. And they wrote a prescription,
Exactly.
and then I was able to order it to be delivered.
Yeah.
Yeah, it's
That one simple policy change not only changed the opportunity to innovate, but it changed the access, right? So like wasn't at all something that like someone that had primary insurance access would be able to
right.
experience,
It
but
wasn't
like
about premium.
yes, everyone. Not only, and once you make something accessible to everyone, that puts pressure on a societal shift. So it went from being very, like exactly what you said, something that feels very awkward to. So let's say we're in 2030 and telehealth was available. If that societal shift didn't happen, we would still have to spend so many marketing dollars to convince someone it's actually okay to just like do a FaceTime call with your pediatrician or your OB or your primary care provider.
Right.
That's not
You'll
something
still get great quality of care.
we
Right.
don't have to convince anyone. That happened
Yeah.
overnight, right? And so like stuff like that, those societal shifts, those policy changes really move the way that innovation can happen. So yeah, so for me, I think, especially in health tech and healthcare, things become such a state by state level policy driven measure that you often see
Yeah.
a lot of health tech companies starting to spin up and they're like, oh, we're doing a pilot on the coast because that's where things are accessible.
Right.
For me, I think it would be game changing if there were policy that allows people to pilot on national levels. The story would be fantastically different for the better, I would say.
Yeah. I mean, we would literally need policies to get standardized.
Yeah, exactly.
I
Yeah.
can't believe that's a thing that we're hoping we can one day have.
Yeah, exactly.
I mean, in this conversation about this intersection between technology and health, and the role technology has played in shifting behaviors or has allowed access, where do you think technology should not be involved as it relates to health technology?
So I don't think technology should make healthcare decisions. It can help
Mm,
inform, it could help guide, but I don't think it's in a place right now to take the place of a provider, but it can always assist. And so, to me, tech is a conversation driver. It's a resource, but it's not the care provider. And I'm not sure, even if we, and this is my personal thesis, even if we get to a place where the technology could do that, I think people really trust a provider. I remember reading this ridiculous statistic about like here are the ranking officials that people trust more. And of course, like not surprisingly, a politician was at the low. Like that's not surprising at all. But at the top was their provider. And that's so interesting to me. And I remember looking at that. And in between there's like teachers and parents, but like top, like above your teacher, above your parent was your provider. You're like, duh, like they know, but so to me, I think that is really interesting because I think that won't go away. Like maybe it'll change a little bit, maybe things will, but people will still prefer talking to a human that is well informed, that can really build this sort of IRL relationship. I think that's really important in healthcare. And I don't think that'll go away.
I mean, I think that makes sense. I think there's a difference between like information gathering versus like, what is happening to me right now with the context that I have, the history that I have,
Yeah.
and the level of variations a practitioner sees of that diagnosis across human beings, right? Yeah. I would love to do a little bit of a rapid fire before I do my signature unmissable close. Okay, so I'm gonna do this lightning round. I'm gonna ask a question, and you just share the first thing that comes to mind. What's one piece of advice you have for people that are building in the middle of a policy crisis while abortion access is under attack and our reproductive health is more politicized than ever before?
Don't do it alone. That's really dumb.
You've said you're 4'10". Funny thing, I'm 4'11". So I found that hilarious. But you have the confidence of someone who's 6'5". What has shaped your leadership style and how has it evolved?
It's just, I'm getting old and I don't give a shit. But it's also building for sexual and reproductive health care. You just don't have a choice but to innovate. And that makes you so much bolder and much more confident. So it also helped my confidence actually quite significantly in that when you're just hit from one obstacle to another, you're just like,
Yeah.
whatever, let's take it. Let's do it. I can do it.
Yeah, I can sense the bullishness you have to have on the mission and the purpose, or else there's roadblocks everywhere, right?
Mm-hmm.
If money and time were not constraints, what product would you build?
Affordable, accessible healthcare. But I'd name that would be more than a product. It would be policy change, as we were talking about. It would be societal shifts. It would be a complete paradigm shift that would be needed in the healthcare industry. Affordable, accessible healthcare for sure.
Okay, so if money and time were not constraints, you would do a radical systems change. Got it?
No big deal.
Done. No big deal. Just make it rain. Okay, so the last question of the day, what's one unmissable shift or new product in health tech, femtech that you think others need to pay more attention to?
I think it's, we talk a lot about making it easy for users. Yes,
Yeah.
we should continue to do that. But I think if you talk to the healthcare industry or people in healthcare, it's health systems and health staff that also, in service of making things easier for the user, there's so much that's happening on the other side that is doing the exact opposite. It's making it so much more difficult for them to do their day-to-day job, to like manage the logistics. So I think that's something we should think about as health tech innovators is how can we make it easy for both health systems and staff as well as the user? Like it's basically a two-prong approach or like
Interesting.
a two-sided marketplace almost in that way.
Right. So not only thinking about how it helps the end consumer being your potential patient, the person, but also the health providers that are kind of part of that multi-stakeholder approach, right? Does an example or something come to mind that people might be able to ground themselves to, that you've seen that approach?
That's what some of the stuff we've innovated. So I'll give a very, very simplistic example.
Okay.
Well, it's not simple at all, by the way. It's very complex, but a simple sort of like one point in the patient journey that we've made easy. So one thing, we've been working with a startup. We've realized, through a ton of user research, the number one obstacle for people that want to get an abortion that oftentimes end up not getting to, and this is not just an abortion, but healthcare in general, we've been talking about this ad nauseum, is cost. So there are people that we have spoken to that said, this is something I would consider. I just can't afford it. And so we've partnered with a startup that has, allowed patients to be matched to federal, state, and local funds. Fantastic. That's great because we're fulfilling the need of the user. And that's absolutely what we want to do when we think about the higher impact goal, which is, reducing sexual and reproductive health disparities. But on the flip side, without this, product, we're also learning from our clinicians that ever since the abortion landscape has been so fragmented, in the before 2022, if you wanted to match a patient to federal, state, and local level cost, it would be something you could find that and match them within 20 minutes. Now, when you're seeing people that are coming out of state, that are coming at different gestational limits where things are very complex, something that took 20 minutes now takes 3 days. 3 whole days to find the criteria to help people match. So what we have are patient navigators. So these are people that help a patient navigate through their service. What we found is that they were spending 40% more of their time just trying to get the logistics of this to work. And what that meant is that's 40% less time they had to actually care for the patient. And so this, this integration that we did with a startup called Autonomy, not only does it allow the patients to just provide information and match them with funds in 2 minutes, that effectively is done behind the scenes, and there's nothing a patient navigator needs to do other than to review it and accept it. And what that did is that gave them 40% more of their time back to actually care for patients. And so that's something that both sides benefit from, right? And that it's a small sliver of an example of the whole, patient need and patient journey. But, when you think about both sides, it only incentivizes the entire ecosystem to want to participate. And this is, in a lot of health tech companies that I talk to, they make fantastic product, but figuring out the logistics of integrating it into our clinics effectively would mean we would see less patients. We would have no more time to spend. And that's not something we also want to deter, right? And so those are the things I think about a lot in health tech, which is definitely want to help bring in more patients and help patients, but at the cost of low quality care at the clinic or low quality time spent with the patient. That's not acceptable. That's something that happens to be a lot of what the health tech industry talks about too, is not only there's a lot of conversation around the patient improvement, but not about the logistics or the health systems and staff improvement.
No, I really loved that example because you're not talking only about a product being part of the patient journey, but then it becomes a part of the medical care journey. Then the practitioners are also now reaping not only benefits, but also becoming more familiar with that technology, and kind of ends up becoming a referral system by itself, right? If they're benefiting from it, they're going to advocate for that same product to their patients as well. So then I think, it also makes me think about, oftentimes if you go from one doctor to another doctor, just the sheer effort of transferring any of your documentation, right? Good luck with that, right? And I think something as simple as that could be innovated with this approach of what if we were actually designing not from a place of selling software, but actually from a point of view of enabling data share and documentation share to all the practitioners that need it for one patient to get the care that they need, and making sure the contraindications and transference of care and just all of that history is supported. So if we were actually thinking of it through the lens of practitioners and patients, I really do think that software industry would look different.
Absolutely.
Ambreen, thank you so much for making the time to have this meaningful conversation with me today on the Unmissables podcast. For those that are listening and not watching, I want you to know you've got two brown women with teal couches behind them and a bookshelf behind them and a plant behind them. We brought a lot of coordination to today's episode, and I loved every bit of it. Thank you.
Thanks, Ariba. Thanks for having me.
Thanks for listening to the Unmissables with Ariba Jahan podcast. If today's conversation sparked something new or made you think differently, be sure to subscribe to the show on Spotify, Apple Podcasts, or your favorite podcast app. And if you're enjoying the show, please consider leaving us a rating or review. It really helps more listeners find us. For past episodes, show notes, and the Unmissables I'm paying attention to, subscribe to the newsletter on Substack or visit unmissableswithariba.com. See you on the next episode.